Well, this week's Cardiology Countdown begins with a small study in heart failure looking at a novel device, chronic vagus nerve stimulation. This has been seen in experimental models to improve LV function, and this initial feasibility study in 32 patients found that it appeared to work well in patients as well. There was a safety study, and they found, I would say, an expected number of adverse events. But they also observed improvements in LV function, with the ejection fraction going from 22 up to 29%, corresponding reduction in LV systolic volumes, and a longer 6-minute walk test done after the chronic vagus nerve stimulation. And so this initial pilot study is very encouraging and should lead to further tests of this novel approach to management of heart failure. At the number 2 spot, we have the publication of the so-called Triana study that found a benefit of primary PCI as compared with fibrinolysis for elderly patients, those over the age of 75, and presenting with ST elevation MI. In this study, they had to call it quits after 266 patients for slow enrollment and found a 31% reduction in death, MI, or disabling stroke. It was not statistically significant. Mortality also trended lower. But they went on in this publication to do a pooled analysis of 2 other studies done in the elderly, senior PAMI and a study from the Zwoli group. And there, the overall odds ratio was 0.64, so a 36% reduction in death, MI, or disabling stroke that was statistically significant. And so good evidence now in the elderly that should push us to make sure that we don't use age to decide whether someone should get primary PCI or not. And as people know, in many of the registries, use of procedures does trend to be lower as patients get older. And so here evidence saying we should push on with procedures as appropriate. And at this week's number 1 spot is a randomized trial published in JACC, done at a single center but a very large hospital in China, looking at graft patency following coronary bypass surgery. And they compared aspirin alone versus aspirin and clopidogrel and did multi-slice CT 3 months post-operatively. And they found a significantly improved saphenous vein graft patency rate. It was 92% as compared with 86% for aspirin alone. And so this study could lead to greater interest in using dual antiplatelet therapy in the setting of CABG, where obviously it is the standard in PCI. So with this week's Cardiology Countdown, I'm Chris Cannon.